Thank you. And now I just want to welcome you all to a very exciting webinar. I know it's insurance. You're like, exciting, what? But it is. It's very exciting. And I'm very, very happy to have three just fantastic and incredibly smart women on this call to be speaking today. All three of them from Cascade Hemophilia Consortium. I'm super excited to have them here. But before that, I also wanted to just do a quick welcome that we've been having this advocacy webinar series starting in 2020, when the pandemic started. And we had our sponsors who sort of shifted with us to this virtual programming who've made this possible for us. So thank you to Takeda, CSL Behring, Genentech, Pfizer, and Sanofi. So if anyone joins us from those companies, we really appreciate it. And now I want to turn it over to Colleen, Stephanie, and Debbie from Cascade, who will be sharing lots of great information with us today about insurance. So I think I'm starting with Colleen. So thank you, Colleen.
Yes, thanks, Sarah. Welcome, everybody. It's really nice to see some smiling faces here on the call. We really appreciate you coming to this presentation. My name is Colleen Joyner, for those of you who don't know me. I am one of the clinical care managers here at Cascade, and I'm a clinical care manager along with Debbie and Stephanie, and I'll let them introduce themselves when they start to speak. But we really do appreciate you being here, especially around the holidays. So just to let you know, today we're going to be talking primarily about, wholly about commercial insurance. So I know some folks were asking if we were going to be talking about Medicare, but that's really its own type of presentation. There are a lot of details about Medicare, but if anybody on the call has a Medicare Advantage plan, you might see there's some overlap, and you may see some things that are really going to be helpful too. The Medicare Advantage plan is run by commercial insurance. So we're going to start out with some general terminology so that we're all on the same page, and then we will go through some areas that I guess a lot of our patients that we work with have questions about, and some things that you need to know in order to make your insurance work best for you. That's what the title's about. So we are going to hold questions until the end of the presentation, simply because it's difficult to give this information and answer those questions. With that, I will turn this over to Stephanie Sibrel, and she'll get us started on some terminology. Thank you.
Hey, thanks so much. Hey, everybody. Thanks so much for joining us, especially this time of year. It's so busy. Good to see everybody. We really appreciate it. So I'm going to get us started today with your insurance plan terminology. So all kinds of fun to start with, but we'll help you as we go through the remaining slides. So first of all, we're going to talk about insurance premium, and then this is the monthly payment that you make to have your insurance. And it's something that we don't always think about when it comes to our out-of-pocket costs, but it's something that definitely is there. Your employer may pay a portion of your premium for you. And sometimes if you're fortunate enough, you might not have a premium at all. And if that's the case, it's very rare nowadays. Consider yourself very fortunate. We're going to move on next to deductible, and this is the amount that you owe for any healthcare services that you receive before your health insurance pays anything, before they pay a penny. So this is usually a set dollar amount that should be available to you at the time of enrollment. So when you're picking your insurance plan and you're looking to see what plan you would like, that deductible should be listed there. And we're going to show you some examples of how your deductible works in the upcoming slides. Moving on next to coinsurance, this is an additional cost portion of your cost share for the healthcare, and it's usually in the form of a percentage amount. This amount you're responsible, and the amount that you're responsible for is actually dependent upon the plan that you choose or you're offered by your employer. know we talked about that a little bit. Some employers, you might not have a choice to pick plans. Other times you actually do have the opportunity to look at higher cost or lower cost plans. So this co-insurance is your cost share portion for your healthcare. So make sure you pay close attention to that as well. And then some insurances have co-pays in addition to co-insurance, or you might just have a co-payment instead of a co-insurance. And this is a fixed amount that you pay for your healthcare services, especially something like an office visit or for a prescription. And the amount of your co-payment is set by your insurance company and might vary depending on the specialty care that's required. So if you go to a specialist appointment, your copayment might be $50, but if you go to a primary care physician, your copayment might only be $25. And that is the same for prescriptions. So a high-tier drug would be more expensive compared to a generic prescription. And your maximum out-of-pocket, this is the total maximum amount that you're responsible for to pay in a plan year. So when that plan starts all over again, that out-of-pocket starts over again. So your insurance will cover all your health care received after you've paid up to your maximum out-of-pocket. So we'll break this down a little bit more in the coming slides. Sarah, would you mind advancing to the next slide, please? Thank you. This one is kind of a busy slide that kind of shows your entire plan year. It's an overview of how commercial insurance will process throughout your plan year. And in the next slides, we're going to break this down step by step, so it's a lot easier to read. So depending on your screen size, it might be pretty hard to read. So Sarah, would you mind moving to the next slide, please? Thank you. All right, so right now we're looking at the beginning of your coverage year. So in this example, we're using January 1st as your coverage year. Not all plans start January 1st. You might have one that starts July 1st. So this one we're just going to use as January 1st of 2022. And at this point in the plan year, you're responsible for 100% of the cost of your healthcare. So in our example, you'll see that Jane goes to the physician's office. Her office visit is $125, and she pays that whole $125. And just be aware that some plans and some offices and healthcare systems are actually making patients pay that amount at the time of service. So just kind of be aware of what your insurance does require of you and what your office or healthcare system requires. Sarah, can you please advance to the next slide? Thank you. And now we're going to show, now you've paid your first $1,500 deductible, and now you're in co-insurance or co-payment. So just as a quick review, this is the amount you pay. And it's usually in the form of a percentage, and it's dependent on your plan. So some insurance plans are 90-10, some are as much as 60-40, where the patient's responsible for 40% of their health care. In this example, Jane only is responsible, not only, for 20% of her health care, and then the insurance plan will pay 80% of the health care. So as you'll see at this office visit, the office visit is $125. Jane is responsible for $25, and then the plan is going to pay $100 of that visit. We'll talk about that a little bit more. Sarah, can you go to the next slide, please? Thank you. And then at some point during your plan year, you're going to meet your maximum out-of-pocket limit. Depending on the year, it could be earlier in the year, depending on the amount of healthcare that you need. Other times, you might not even meet your plan limit. And you might have family members on your insurance as well. So you might individually meet your maximum out-of-pocket, but you might have a child who has not met the out-of-pocket. So you might not have any responsibility for your individualized health care going forward for the remaining year. But if you have other family members who have not met the maximum out-of-pocket, you might still have medical bills that you're responsible for them. And please just remember that even though you have met your out-of-pocket limit for your plan, you're still responsible for paying for that premium that we seem to kind of forget about sometimes. And that is, remember, the premium is the monthly cost to have your health insurance. So we're looking at the end of the year, and hopefully this happens and you've met the maximum out-of-pocket before December 31st, because you really don't have any other time. So say you've met your maximum out-of-pocket in September. If you have an office visit in October, that office visit costs $125, and you have $0 responsibility, and your plan is going to pick up that whole dollar amount for your office visit. So we ran through that kind of quickly, but we'll talk about some more stuff, and then we'll have time for questions at the end. Now I'm going to turn the presentation back over to Colleen, and she's going to keep the presentation going for us. Sarah, can you please advance to Colleen's slide? Thank you. Thanks,
Sarah. Thanks, Stephanie. So we're going to switch gears just for a little bit. And remember, I see some questions popping up. That's a great question, and we'll address that at the end because it is a really good question. Thank you. So when it comes to the type of plans you have, as mentioned earlier, sometimes we get a choice for the type of plan. So we're picking a plan, maybe we're picking a plan on the marketplace, or a lot of large employers will have a cafeteria of a style menu that you can choose from. So you can choose from different companies sometimes, you can choose an HMO, you can choose a PPO. It's all dependent on what your employer is offering. But either way, you really want to know what type of plan you have, because there are a lot of different stipulations or rules that the plans have that you're going to want to know about. There are really a number of types of insurance plans, but the two that we see the most of are HMOs and PPOs. Now, when I'm looking at an HMO or a PPO, I think of two things. I think of affordability on the one hand and flexibility on the other. So it's kind of a scale. It'd be great if we got affordability and flexibility. We could have it all, but it's usually with an HMO, we're looking at affordability, the cost is lower. It's less expensive. You might see lower premiums. You will see lower premiums per month. If you're lucky, you don't have to pay any premiums and your boss does that for you, but it is lower. And then there's lower out-of-pocket costs, including even pharmacy and office visits. Everything is a little bit lower. But as a trade for that cost, that lower cost, you're required to stay within a network of providers for your care. And that's a prescribed, predetermined network of providers. If you go outside of that network, then you may not get that office visit covered, for example. Another point with an HMO is that you're required to choose a primary care physician. And this is particularly important at the beginning of the year. So January 1st, you get a new plan and you realize, wow, this plan's an HMO. What you need to look at is getting a primary care physician, making sure the insurance company knows you have a primary care physician, because that primary care doc is the gatekeeper to all of your care. And they refer you out to your hemophilia treatment center. They have to do an actual referral to if it's infectious diseases or if it's orthopedics or whoever is involved in your care, any specialist, they are the gatekeeper to send those referrals out. A PPO, on the other hand, again, it's very, very flexible. You can see different providers and go outside of network, but it tends to be more expensive. And that's the trade-off. Again, there's always that trade-off. If you go outside of the network, this is called a preferred provider organization, and it is an insurance company, so they want to keep their costs low. So they will charge you less if you stay within a particular network, and charge you more if you go outside of that network. And so it's important, if you have, a co-insurance, for example, to understand, if I love my doctor over at U of M, but I also love a doctor over at St. Joe's, you may see a price difference with that. So that's generally the difference between an HMO and a PPO. Sarah, could you switch slides? Thanks. Now we're going to get into some tips. These are pretty, they're important tips. Like I mentioned, as I mentioned before, make sure that your insurance company knows who your primary care physician is. And the reason you need to do that is because if you don't do that within a particular period of time, they do give you a grace period, but if they don't have a physician's name, they're going to assign you a physician. So they're going to give you a primary care physician, and everybody likes choice. You want to know that you're going to somebody that you're going to like. So please keep that in mind. Also make sure that, again, that you've seen the doctor, because if the doctor, your primary care physician, hasn't seen you, that doc may not send the referral out. And that's particularly important for your hemophilia treatment center and other services that you may have for your care. The third thing that you want to think about, or the second thing, if you're picking an HMO plan, make sure that all of your providers are in network, okay? We have a lot of folks call us up at Cascade as a specialty pharmacy and say, are you guys in network for United Healthcare or, Blue Cross Blue Shield? And we really appreciate that, because we can say yes or no. And if they'd like to stay with us, that's important information, or they can go to someplace else with another plan if we're not in network. And we also advise that people call their hemophilia treatment center and find out where they're located, if they're in network with a particular plan. That's specifically if you're choosing a plan, if you're able to choose your plan on the marketplace or through an employer. There are lifestyle considerations. And what would a lifestyle consideration be? If you are a person who travels out, if you're lucky enough, you go down to Florida for a few months. If you're a snow bunny and you go down to Florida for 2 or 3 months a year, you have to know that with an HMO, they will pay for emergency services. So if you're at Disneyland for 2 weeks and you twist your ankle, they'll pay for that emergency service, but they won't pay for any regular care. So a regular office visit, regular PT, things like that. They're not going to pay for that. So for parents who have kids that are in college and you have an HMO, you want to pay attention if your child is going out of state or if they're going somewhere. Like Debbie's son goes up in the UP. I hope you don't mind me saying that, Debbie. But he's up north. But you may want to get student insurance as a backup for your college age kids. And in fact, some universities are requiring that you get student insurance as a backup if your student is out of state. So those are just some of the lifestyle changes. But as a whole, if you receive most of your care in an academic setting, maybe a DMC and all of your providers, it's a good plan. It's a good plan to have. Switch slides, please, Sarah. For a PPO, most of my tips are related to cost, actually, and trying to keep those costs or understand where the costs are. Again, with a PPO, you can go outside of network. So you want to ask, which providers do I have are in network? Which providers are out of network? You can do this, by the way, and I should have said this in the HMO section. You can do this by going on the site for the insurance plan and type in network providers. They will tell you who those providers are. So you can find that out right on the insurance website. And you want to know that because you want to know what your cost share is going to be for out-of-network providers if you choose to do that. And let me explain. If you have a co-insurance, as Stephanie said, and your out-of-network co-insurance cost share is they're going to pay 60%, you're paying 40% out-of-network. One office visit for one doctor could be $100. Another doctor might charge $200. And so that's a big difference if you have to pay 40%. So it's not, it can vary by doctor. So you want to find out, you can always call the provider and get an estimate of it. How much does an office visit cost, for example? You can do that. You can call a doctor up and do that. So you know what you're paying. All right, go ahead and switch the slide, please, Sarah. Now, I have this slide for a reason, because insurance can give you a headache, and I'm not lying. There's a lot of details, and there's a lot to know. So breathe, just relax. It's always important. I'm a social worker, and I always say, give yourself a lot of time to review your plan. Take it in chunks, breathe, relax, take another chunk, and just, take it in that way. I do see, Ashley, I can answer this. We see more, I feel we see more HMOs than PPOs, and but it's interesting that PPOs, the Kaiser Permanente Foundation has said that PPO is what most employers have. They did a study in 2019, and I found that interesting because it is more expensive. It is a more expensive plan. Okay, switch. Thank you. Regarding your factor, and this isn't, earth shattering. It's not going to ruin you if you don't know this, but it would be nice to know. How are your medications covered? So usually Amicar, Stimate, Lysteta, they're usually covered on the pharmacy side. Now Factor gets a little bit, is a little different, or Hemlibra, it's a little bit different. It can be on the pharmacy side, or it could be on the medical side. And this has nothing to do with HMO or PPO. It's just how the plan is designed. And why would that be important to you? It's important so you understand what your costs will be. If your factor is on the medical side, then you're going to be paying what Stephanie had talked about earlier. You're going to be paying your deductible, and then you're going to be paying a co-insurance in between until you meet your maximum out of pocket. A lot of folks who are on Profi, boom, their deductible, everything's taken care of, the first month or two. And then that's a good thing. But it's all dependent on where that deductible is and where that maximum out of pocket is in that plan. If it's on the pharmacy side, on the other hand, you are going to be paying a copay. So your Factor or your Hemlibra might be a $40 copay. The price is determined by a tier. They're called tiers for the medication. A tier 1 medication is the least expensive, and then a tier 5 or 6 is more expensive copay. And so those are the differences on where it's getting paid from and how much it's going to cost you. You can find out where your factor is going to be on your summary of benefits, which Debbie's going to show you a summary of benefits in a little bit. Or you can even call just the number on the back of your card and say, I'm on a Dynamate. Can you tell me please where that's covered? And they will answer that for you. And your specialty pharmacy this is a question a specialty pharmacy should know. You can call anyone, wherever you go for your specialty meds, and they will tell you as well. A drug formulary. What is a drug formulary? A drug formulary can be found on your insurance website. You type in, drug formulary on your plan, and what will pop up is a list of drugs in different categories. And you can go through the list to be sure that your medication, and it might not even be bleeding disorder medication, but any medications you're taking are on that list. And that's particularly helpful if you're choosing a plan and you're trying to decide. I mean, there's no reason to take a particular plan if one of your most important drugs aren't on that drug formulary. The drug formulary will also tell you what tier. I talked about tiers. It will tell you the tier, oftentimes, of where that drug fits, so you can understand the copay. But I do want to say, if you go on your drug formulary, don't panic if you don't see your factor product or your Hemlibra on that drug formulary. That could mean simply that it's on the medical side. A drug formulary is only for the pharmacy side. So that's it. Don't panic. Call the number on the back of your card and be sure that your factor is covered on the other side. One tip I want to give here is really pay attention to your mail. Now, I'm honestly the worst. I have a junk pile, a little bowl, and I throw my mail in that little bowl. And if I'm not in the mood to look at it when I get home from work, sometimes it goes there. Don't be me, because companies can actually change the drug formulary anytime they want. And it sounds illegal, but it's true. I mean, they can change it mid-year and suddenly not cover a drug. But particularly when you're starting your plan, or when January comes, that's usually when they change the formulary. Just take a quick look at the formulary, or open your mail, and pay attention to what they're sending you, so that you can be you can be ahead of it, be ahead of the game. Finally, we have prior authorization. I have a lot of folks who ask me, what is a prior authorization? And it's basically something that's done behind the scenes. Your pharmacy or your doctor's office sometimes for procedures does what's called a prior authorization. And that's basically the company is saying, it's okay, go ahead and send this drug. We agree with it. So we work with your Hemophilia Treatment Center to gather all your information. It's usually medical records and such, and send that prior authorization form justifying why you need to be on that medication. And then they approve it. And at that point is when we can send it out. Now, I don't bring this up because you have to do a prior authorization, but I do bring it up because prior authorizations take time. And quite frankly, it makes me sweat sometimes, because we know you need to get your product. We know you need your factor. So they can take anywhere from 72 hours up to 2 weeks. They have up to 2 weeks to authorize this stuff. Now, your pharmacy should be on top of it. They should be doing these prior authorizations as it comes up. But sometimes there's a change in your prescription. So we need to know that as soon as possible. So please order earlier, so a week early, just earlier, so that you can be sure that prior authorization is complete and it's been approved. Gosh, I was going to make one more point. Well, it must not have been in emergencies. We understand that there's emergencies. So if you have an emergency, everybody has them. We usually can put it in as an urgent order, and it can be done in 24 hours, but we don't use that. We use that sparingly because, we want to be taken seriously as well. So just for regular orders, please just call earlier. So it's very helpful, and you can be assured to get your factor on time. The bottom line for all of this is ask your specialty pharmacy for help, or ask your treatment center for help. And if they can't help, call the customer service on the back of your insurance card. there are a lot of people, we have a lot of social workers in Michigan, and I can tell you with your treatment center, we all talk to each other and we all help each other. So if you need help, please call. So I'm going to turn this over to Debbie now. And she's going to talk about.
Thanks, Colleen. I'm Debbie Whelan. I'm one of the care managers here at Cascade, along with Colleen and Stephanie. And I'm going to talk about out-of-pocket costs, meaning the money that you have to pay for your healthcare. So it's a good idea to take a look at your out-of-pocket costs for your insurance plan, including your premiums, deductible, co-insurance, any co-pays. I think it's a good idea to have a kind of an overall picture of what is the most that you would have to pay for over the course of the year. Usually with plans that have lower premiums, they're going to have higher out-of-pocket costs. So if you're somebody who does get a choice between insurance plans, and you typically have high healthcare costs, you might want to consider choosing a plan that has out-of-pocket costs that are more affordable for you. Sometimes that might mean the monthly premium is going to be higher, but it might still save you money in the long run. So that's just one tip. In terms of looking at that maximum out-of-pocket, it's good to know what your plan's maximum out-of-pocket is, and I'm going to show you on the summary of benefits one of the places that you can find that information. So again, just to review, that's your maximum amount that the insurance is going to expect you to pay out of pocket in a year, and that does not include your monthly premiums. So usually that maximum out of pocket includes what you've paid for your deductible, any of those co-insurance and co-pays. But it is a good idea to take a look at the details of your specific plan to see what counts and doesn't count towards your maximum out of pocket. And again, I'll show you where to find that on the next slide. So now that we kind of talked about what you have an idea what your costs are going to be overall for your insurance plan, you might be wondering if there's any financial assistance out there to help you with those out-of-pocket costs. And so I'm going to talk about a couple of those options. In Michigan, you might be eligible for the Children's Special Health Care Services program to help cover out-of-pocket costs for care related to your bleeding disorder. In Ohio, if we have anybody on the call from Ohio, in Ohio, the BCMH program, which is now called the CMH program, they've apparently dropped their B, that's the Children with Medical Handicaps program, is an option for Ohio residents up to the age of 22 to assist with costs related to your bleeding disorder care. And then I understand in July of next year, so in July of 2022, I understand that Ohio's program will expand to cover people up to age 23. So if that is applicable for anybody. So the Children's Special Health Care Program in Michigan and the CMH program in Ohio are both state-funded programs, and they can help with out-of-pocket costs for your medication, as well as things like your HTC visits or labs or radiology or things like that that are related to your bleeding disorder. So that's one option for assistance with your out-of-pocket costs. Another option that I wanted to talk about is manufacturer copay assistance. These are sometimes referred to as copay cards, and they're programs that are available through the manufacturers of your medications, including factor products. And these copay cards can assist you with out-of-pocket costs for your medication or your factor product. They don't cover out-of-pocket costs for other things like going to your clinic for visits or getting x-rays or having lab work done or anything. They only cover out-of-pocket costs for your medication or your factor product. So that's one thing to keep in mind. Another important note about the manufacturer copay cards is in the past couple of years, some insurance companies have started programs called copay maximizers or accumulator adjustment programs. And those programs have changed how copay cards might work for you with your insurance, if your insurance has one of those programs. So if your insurance now has one of those kind of programs in place for your medication, you can still use copay cards, but the amount that the copay card would pay on your behalf would no longer count towards your deductible or your maximum out of pocket. So we're not seeing this with all insurance companies, but we're seeing it with some insurance companies. So again, to Colleen's point, open your mail, read anything that your insurance sends you. If you get a notification about something like that, be sure to call, ask for help, ask questions. I know HFM has put out a lot of information to the community about these kinds of programs. Thank you, Sarah, for your work on that. And there's advocacy going on around that. But it's a good idea to check and see if your insurance policy might be a plan that now includes any of those kinds of programs, especially if you're already using a drug copay card. So just to summarize with financial assistance, the important message is if you need financial assistance with your out-of-pocket costs, there are options out there. And I would recommend that you talk to your HTC social worker or somebody at your specialty pharmacy, if there's someone that you work with, to see what might be the best fit for you, given your needs and the kinds of medical care that you're receiving. Can you go to the next slide, please, Sarah? Thank you. So this is a sample of a summary of benefits. So I think we've had a couple of questions about how do you find out what the actual details of your plan are? And the answer is your summary of benefits. So summary of benefits is a document that you would get from your employer if your insurance comes through your job, or from the insurance company that you purchase your insurance from if you buy it on your own. And this is just page one of a summary of benefits. They usually are 3 or 4 or 5 pages long, but they always look the same. And so I think it's good to see that, so you kind of recognize that as you're going through your own paperwork. It's a standard format. They're set up always in the same way. And they lay out basically what your expected costs are with your plan. So looking at this example, if you look down the left-hand side column, you're going to have questions like, what is the deductible? And there's your information. What might be covered before you meet your deductible? Sometimes preventative care is covered before you meet your deductible, which is good to know. Things like what is your out-of-pocket limit or that out-of-pocket maximum for your plan? The information will be right there. What's included in that out-of-pocket limit is right there. And then things like Colleen was referring to, do you need a referral to see a specialist? Would you pay less if you stayed in your network? That kind of thing. And on subsequent pages, they usually cover things like what are the different copays for different categories of medication, and things like that. So I recommend that you find your summary of benefits and take a look at it. It should be able to answer quite a few questions that you might have about what your out-of-pocket costs are. So next slide, please, Sarah. So the last thing that I want to talk about is multiple insurance plans. What happens if you have more than one insurance plan? So there's a few common situations that can happen where you might have more than one insurance plan. It could be that maybe you have insurance through your employer and maybe you're also on your spouse's insurance. Or it might be that you have insurance through your employer and you have Medicaid or Children's Special Health Care Services or in Ohio, BCMH. Another common situation is kids. Kids might be on both parents' insurance plans. So you might have a child who has more than one insurance plan. So when you have more than one insurance plan, what we have to think about is coordination of benefits. So there are very strict rules about what insurance is going to cover you first or be your primary insurance, and then what insurance is going to come second and third and so on. So if you have 2 or more insurance plans, you are required to coordinate your benefits. So what does that mean? You're required to notify each of your insurance plans about all the other insurance plans that you might have. So for the example of if you have an insurance through your employer and also through your spouse, you need to notify your insurance about your spouse's insurance so they know what else you have. And then you need to notify your spouse's insurance about the insurance that you have through your employer. That's coordinating your benefits. So you can usually notify your insurance by calling the number on the back of your card. Or if you have an online account set up through your insurance plan, you can notify them that way usually. But the magic terms when you talk to your insurance are, I need to coordinate my benefits. So then your insurance plan can tell you exactly which plan is primary for you and what's going to be second for you and third and so on. If you have multiple family members on your insurance plan, what's going to be your primary insurance for you might be different than what's going to be your primary insurance for your spouse or for your child. So be sure you know how it's going to work for everybody. So not only is coordinating benefits the law, it's actually really important that you do this so that you can make sure that your bills are covered properly. I mean, if you have more than one insurance, you want to get the most benefit you can get from having that. So you want to make sure you're coordinating your benefits so that you get the best possible coverage and you don't get any surprise bills. So, which nobody wants surprise bills. In addition to coordinating your benefits, I recommend you always let all of your medical providers know about all the insurances you have. So your HTC, your pharmacy, any other clinics you go to, you always want to give them all your insurance cards. Even if you don't know yet which one's first and which one's second or whatever, give them everything that you have and they can usually help you figure out how they're going to work together. They can help you with coordinating benefits if you need it. And then they can make sure that everything is billed in the correct order. So the last point I wanted to make on this slide is that the rules about coordinating benefits and who's first and who's second and all that are kind of complicated. So I'm not going to go into all the details of them here, but there is one rule that we get asked about a lot that is pretty straightforward. So if you have a state-funded insurance plan like Medicaid, or Children's Special Health or BCMH in Ohio, they're always going to be the last person to cover your medical bills. So if you have, for example, insurance through your employer and Children's Special Health Care, you can know for sure that your employer insurance is going to be first and your Children's Special Health Care is going to be last. You still need to report each one to the other one, but you can know already that anything that's state funded is going to be your last insurance to cover your bills. So that's all that I had. So I'm going to turn it back over to Colleen.
It's me again. I guess I just want to say, again, this first point is just know that there is help out there. We're all here to help. Your HTC social worker is there to help. And you know, just ask the questions if you can. And also, I wanted to share this insurance toolkit. The insurance toolkit is something that NHF came up with. It's particularly helpful. It's really, I don't know if anybody can see me, but it's a booklet that, I've got everything blurred out, but it's a booklet anyway that's on that website. It's on the NHF website and you should be able to find it fairly easily. And it helps to compare plans so you can look at each plan and it really lays it out for you so that it's easy to see what's important. to look at and how to find something that really works for you best. So I would highly recommend that, taking a look at that link if you're choosing a plan. And with that, I just want to say thank you for being here. It's so nice to see some of your faces. I haven't seen some of you in a while, so it's great to see you. And I guess we'll open this up to questions.